Hello, my name is Dr. Zubia Afzal and I am here to talk about the relationship between obesity, diabetes and fatty liver. There are two main types of fatty liver disease which are alcoholic and non-alcoholic. Out of these two, non-alcoholic fatty liver is way more common than alcoholic. Nowadays, it is being called metabolic dysfunction associated liver disease. It tends to develop in older people, however, with increasing prevalence of obesity and diabetes, young adults have become prone to it. The worrisome part is that it may have no symptoms at all and can be present for years before anyone notices it. Now let's talk about non-alcoholic fatty liver disease. It is a very common disorder which affects around 25% of the global population and is closely related to obesity and diabetes. If we talk about obesity, it has nearly tripled since 1975, and according to published research, for every 5 kg per meter square increase in the BMI, your risk of developing diabetes increases 2 times. When excess body fat accumulates around your belly, it can lead to insulin resistance. If insulin cannot perform its action, it will lead to high sugar level in the blood, which can ultimately lead to type 2 diabetes. Regarding obesity and fatty liver, according to a study, 55% of obese individuals had fatty liver, while only 22% of non-obese individuals had it, which is around half. Obesity contributes to progression of fatty liver through various mechanisms, the obvious one being deposition of excessive fats in the liver, but also by creating insulin resistance and inflammation of the tissues. Finally, we'll look at the relationship between diabetes and fatty liver, which could be a surprise as the two entities may seem separate, but they are closely related. Around 80% of people with type 2 diabetes have non-alcoholic fatty liver. With insulin resistance, liver is unable to utilize fats and they get deposited within the liver. People with poorly controlled diabetes are more prone to develop non-alcoholic steatohepatitis, which is a severe form of non-alcoholic fatty liver. It can further lead to fibrosis, also known as the cirrhosis of the liver, which could be a strong risk factor for cancer. Let's talk about management. Any person who has obesity or diabetes, considering the high chance that he may already have a fatty liver, it is better to manage all these together. As all three of these conditions are coexisting, trying to overcome any one of them will automatically help you to get better overall. You can change your lifestyle choices such as dietary modifications, which includes more consumption of fruits, vegetables, and whole grains. You should do some regular physical activity to help you lose some weight, and it will also help you to control your diabetes. In case these interventions are not enough, your doctor can also prescribe you some medications for your diabetes and for your liver health. Thank you very much. I hope it clears a lot of confusion regarding obesity, diabetes, and fatty liver.